Ah,
Good morning, Denzel.
good morning.
Happy
How's
New
it going?
Year.
Happy New Year. It's good to see you, even though you're around the corner.
Well, yeah,
You
we
know.
have to feign like we just saw each other for the first time in so long. So it is
How's-
2022.
crazy to believe that
Yeah,
it's there. It's there.
it is weird to say that.
We have both made it through our first quote unquote year here with the organization. Uh,
Yeah, we
you
sure
know,
have.
lots of change since I think last January, uh, organizationally and also pandemically. Lots of change, but excited and so thankful that you've been a part of this journey.
Oh,
Uh,
well, I'm grateful to have been a part of this journey.
it's been
Thank you
good.
for being on this journey with me.
Uh,
Yeah, 2022 seems really weird, not just because every new year seems like, oh my God, I can't believe the numbers are changing. And it just like thinking back to grade school of like, someday it'll be the year 2000. And then now it's like, oh, we're 22 years into this. Um, our good friends at Facebook reminded me that 10 years ago, I'm having my queer anniversary. So 10 years ago, I came out. So this is my 10-year mark of being a big old queer. So
well,
grateful
I
for
mean,
that.
I think you've always been queer. You just now stepped out into the
Yes,
world
yes,
as your full
yes, yes.
self.
There it is. There it is. No, but grateful to be here. I think oftentimes I saw a post that someone said is like, oftentimes when we're feeling down, just remembering that our past selves, this was what we were hoping for. And so
Mm,
just pausing and really taking that in and really appreciating that one at one point in our lives, these were goals.
yeah,
And even if it might feel like we're still going toward the next goal, like this was a goal. So just being in a space to appreciate that. So
yeah.
um, I'll be done being sappy of my new year
No,
little
don't be. Don't.
duties.
Well, no, it's actually a really great thing to reflect on. I think I had a similar reflection maybe a day or two ago. Sort of like, we are in a place, and we continue to be in this place of a journey of progression and self-development and all these things. And so it's important for us to recognize it and take stock of it and appreciate all the work and hardship that maybe we've gone through to get here,
Yeah.
and realizing that we still have to do work on ourselves and in our community to continue to live authentically. So take stock, recognize it. I think we all should lean into it a little bit more sometimes.
Agreed. Agreed. So let's launch into some updates. What's going on at Stonewall, Denzel?
Wow. Well, I think the thing that I really want to take a moment to talk about is our new art installation that happened here at the end of the month, in December, at the end of the year. It was an initiative that we tried to get off the ground, and I'm glad to see it happened in a year's time. I'm
Mhm.
thankful to Betsy Pandora and the Short North Alliance for so much of the work that they did to help us move this forward. But we have a wonderful installation, public art, right outside our front door, Pride Circles, designed by Lisa McClintock. And actually, I could say she installed because I saw her out there with the machine helping install it,
Mhm.
fire it. So it designed, installed by a wonderful community partner. We are so excited about Pride Circles because I think it is a physical representation and manifestation of a lot of what we talk about, and being able
Yeah.
to say we want to ensure that the community is seen and uplifted. And I think when we have such a large installation of Pride Circles right outside our front door, you can't miss it. The community sees it. It is visible from the air, so I definitely know we can see it from up in Plains, which is great. But when I think about just our community across Central Ohio, across Ohio in general, being visible, being out, being loud, being proud, being queer, being here is important. And I
Mhm.
think this Pride Circles art installation gives us the opportunity to do that. And it also takes the story much further than just Columbus and Ohio. Often when we travel, or at least when I travel, I go to other cities and sort of see what sort of physical manifestation of their queer community that they have in those places. And, crosswalks and different things like that. But I think this is one of a kind.
Yeah.
This is a one of a kind installation on a public right of way, at least in Columbus, and again, as I said, across a number of communities I've traveled to. And I hope that we will see this piece be uplifted by not only our community but communities outside of the state. So So that was one big thing that I was really excited to see come to completion and have such
Hmm.
great partnership from the community and the city of Columbus that worked in tandem with us in the Short North Alliance to get that done. I think coming into the new year, we are additionally excited. We have been on a journey being able to get our space up to a place where we can welcome community members in even during the pandemic. And our physical space is just that. It is a community center, much like we are the 14th largest city in the country, and much like many of those other cities across the country that have LGBTQ centers and spaces. We want to ensure that this space is a welcoming and affirming space for all of our community. And so we've worked hard to make it feel a little more welcome and warm when people come in, to invite folks in for a reason and purpose. And that's not only by making it welcome and warm from our staffing side of things, but literally just having the building feel a little bit more inviting. So thankful to the team here and our volunteers and our partners at Zen Genius who donated things, and our partners at Continental Office who did branding in the building. But we've now added our liquor license to our event space.
Yeah.
Which is really exciting. So that does allow us to increase opportunity for community engagement and for space rentals. We are a center. We opened up our space in 2019, and we invite the community to consider us for events, meetings, weddings, ceremonies, military progressions, which we've hosted thus far.
Retirement parties.
We'll have one coming up here in March.
Yeah.
Wink, wink. More to come about that special moment. But I think it has been a labor of love and micro pieces to ensure that we can get the building up to snuff to be able to do these things. So want to invite the community to think about that. If they go to our ways to support on our website, you'll see that space rental and event rentals are one of the links that you can do on our drop down. So we're excited about that. And in that space development, something that we haven't really talked too much about is that our LGBTQ coffee and tea space is nearing completion. Thanks to so many partners in the community who made contributions, Abercrombie and Fitch, AEP, CAS, like some of our folks who've really said, hey, let's lean in and help support this social enterprise for Stonewall organization, but also economic uplift for the community, as we really will be focusing on skills development and training for community members in the coffee and tea space. And it really is coffee and tea. So we're not trying to blow it out of the water with all the cafe bites and things like that, but really focusing on skills that someone can take to improve themselves and the community in other ways once they walk out of our program. So that's been exciting, nearing completion here. Some folks have gotten a sneak peek on the inside, and maybe we'll put up some photos online so people can take a look and see what that looks like as well. I think probably the thing that people are thinking about is Pride. We just saw our partners up in Cleveland, the Cleveland Center, announce their return to in-person Pride next year at the beginning of June, which we're really excited to see that and uplift that messaging. Our Pride information has been up on our website since about October, November of last fall. We knew it was coming. We were working and excited about welcoming people back together in community and celebration safely, and in partnership with the city of Columbus. Last year when we tried to do our Pride events, we didn't get approvals. We weren't having permitting, and June came, and that's just when they started permitting, and it was a little bit too late for us to start thinking about what we could do in person. This year, we are well ahead of that game. We are working with the city closely, talking and having conversations, working with the Columbus Police Department as well, and having conversations about how they will appropriately engage with our teams and our community members and be supportive and be present, but be silently present in the background as well to be supportive and do the protection that they're supposed to be there for. So that's been exciting. We're looking at and hopefully partnering with our community partners across the Columbus region to uplift our Pride weekend and our Pride events. I think the thing that I always want to make sure that people understand is that Pride is Stonewall's largest single fundraiser that happens annually. But Pride is also an opportunity for us to welcome over 700,000 people from across the country and internationally to the Columbus region for a weekend of celebration. And it's a wonderful wonderful opportunity for us during that weekend to uplift our LGBTQ establishments, our LGBT nightclubs, bars, restaurants, stores, and shops. And so we really, really hope that this year during Pride and during Pride weekend, we can activate our community in a way that we've never done before to ensure that their doors are open and people are welcome to be a part of that. So we'll still do Pride events in our festival, but again, we want to work closely with our local partners to ensure that they are receiving just as much uplift and benefit from having over 700,000 people in the region. So if people are interested in learning more about Pride, they can go to /Pride on our website, so stonewallcolumbus.org/Pride, and find out that information. I know we've got some events coming up that Zach may want to touch base on.
Yeah, I just wanted to give an update about some programming. As we speak, our Trailblazers, which is our award-winning 55 and over LGBT adults program. They are, as we speak, viewing the new Van Gogh exhibit at the Columbus Museum of Art. So huge thank you to the Columbus Museum of Art for partnering with us and providing a socially distant activity for our LGBT adults 55 and over. And again, if folks are interested, if you fall into that 55 and over category and you're looking for some social engagement, some of it is going to take place during the day. Some of it is going to be taking place on the weekends and in the evening. So again, understanding that 55 and above is a large swath of ages and different lived experiences, but we try to provide a different array of programming so that folks are able to attend. So if you're interested in that, you can find out more information again on our website, stonewallcolumbus.org. You'll see a drop-down box for programs and you'll see different categories and you'll find more information there. You can sign up for the Trailblazers newsletter there. So again, if you're interested, 55 and above, stonewallcolumbus.org, and look at our programs. We also have coming up next week our women's book club. So we just released last week. We got the January 22, not just January, but the entire 2022 list. So if folks are interested in joining our women's book club that's open to all women's, our women's book club, along with a lot of our other annual programs, are running in a hybrid format. So if you're worried about social distancing, or maybe if you just want to fit in some more activities into your schedule, a lot of our programs are running in a hybrid format. So check those out, and I'm happy to answer any questions. You can email me at zboyer@stonewallcolumbus.org. So if you want more information about our programs, a lot of our programs, if you're looking for updates, you can look at our events calendar. So if you go to stonewallcolumbus.org, we have our events calendar there. That's not only uplifting our events and programs, we also invite our community to put their programs on there as well. So if you have an LGBT affirming and supportive event, whether your organization is solely based on LGBT issues or not, we want to uplift that for the betterment of our community. So if you have some programs that you would like to see listed on our events calendar, you can check that out. And you might already see some annual programs for other organizations that are either monthly programs or weekly programs that we have posted on our events calendar, just because, again, we don't see that space as being something that is solely for our in-house programs. We want to be able to provide a resource for our community to where if there are LGBT focused and affirming events happening, we want to be able to uplift that work. So you can check that out again at stonewallcolumbus.org. We have our weekly programs running, and again, those are running in a hybrid format. We have our men's coming out group, our women's coming out group. We also have, I just spoke with our in-house clinician for our mental health resources. Right now, there is not a wait list, so if folks are looking or need some resources for mental health, they can check out our websites. So again, that's going to be under our resources tab. So again, a lot of it is just going to our website and checking out and seeing what we have to offer.
Well, you know, just I think I'm glad that you do point out the website, because it is actually probably the gateway to many people looking and seeking resources and information from Stonewall and from the community. Yeah. In the last year, we probably saw a I don't even know how to say it right, 300% increase in website activity and engagement, which I think is pretty exciting, but also demonstrates why it's so important for us to work to gather information that are important resources for our community. People do come to the Stonewall Columbus website to find pathways to other resources and connection in the community. So we do encourage our community members to ensure that they are having their information listed on our website, but also posting things on our events calendar.
Agreed. I'm trying to think, is there anything else we want to announce before we bring in our guests?
No, there's nothing major to announce, but I think one of the things I do want to sort of talk a little bit about briefly, and encourage people to look at. If folks aren't signed up to our newsletter and our mailing list, I'd
Mhm.
encourage them to go to our website and do so. In particular, because that's where we do put out information about updates and things that are going on at the center, and within the organization. It is also the place where we make calls for giving support. We
Yeah.
do ask for support donations to get work done and accomplish it. It's also where we make calls for volunteers, and give
Yeah.
updates, events, and engagement. So I do want to encourage community members, if they haven't signed up for our newsletter yet, to do so. It's stonewallcolumbus.org. And once you hit the landing page, you'll see a newsletter information and ways to sign up. In particular, earlier this year, we put out a Happy New Year message that kind of just stepped into some of the things we'll be working on and looking forward as an organization. As we said at the top of the hour, half hour, we both had the privilege of being here for a year. And as I think about the forward momentum of our organization and our path forward, some of the areas that I want to make sure the community understands that we'll be wholly stepping into, which are critical for ensuring our community is uplifted and thriving. One of the areas that we really have seen and done some work in is economic empowerment. So as an organization, we're going to step more into that space. We were lucky to have financial education partnerships last year, and we're going to look into some of those this year. But again, as we mentioned with the cafe, we're really looking about how we can create work empowerment places and skill development courses for folks. We launched our Q Jobs platform last year, which we are posting community jobs to. That again, these are companies and organizations that are looking to work with queer identified folks and wanting to uplift that. So really stepping into the economic empowerment space more as we turn the page and look at our next 40 years as an organization. Last year, we merged with Family Pride Network, and we're really stepping into the family creation space, and looking at resources that will ensure that the variety of queer families are finding pathways to create families however they so choose. We're excited to work with some of our new partners in residence, Quality Family, Choice Network, to be able to uplift with the work that they're doing as they look at family creation in a variety of ways. And we'll have some more programming coming up in that space as well. I think we'll continue to do our work in identity enrichment, and really ensuring that our LGBTQIA+, right, all of the identities that fall under our queer umbrella and our queer community, are understanding that they are important and vital community members, and we want to do work to uplift each of those representative identities. And so we call on our community members to step into our space, and to be partners in that work. We individually don't step into all of those intersectional identities, and so we really do call on others to do that. So we'll do more of that identity enrichment work. And then I think finally, the piece that I think we all are talking a lot about as a society, as a culture, is personal wellness, and what that looks like. And it's not necessarily the physical wellness. It's mental health. It's emotional wellness. It's thinking about how we can be more cognizant and aware of our spaces, our bodies as humans. And that will step into a lot of different spaces, but really excited about the partnerships that we've created with Equitas Health and Ohio Health and Columbus Public Health. And we've got a partner from Columbus Public Health talking later with us. But really, those are the spaces where I'm excited to see us step into in the future, and really hoping the community will be supportive and encouraging and partners in the work that we do, in areas of economic empowerment, family creation, identity enrichment, and personal wellness. So excited about that, and looking forward to a really dynamic year in partnership with the community here in Columbus, but I think across the region as well.
Yeah, agreed. And I think that you hit on the topic early on of ways that folks can become involved and support our organization and the broader community, not just fiscally, but also through volunteering. This past Saturday, we were slated to have a volunteer event for just drumming up some excitement, as well as providing some educational resource about what volunteering for Pride looks like. And just to be conscious of where we are with the just being cautious with COVID, whether that is postponing events or moving events to being virtual. We decided as an organization that volunteer event, though it is really important, because again, Pride is not just within the walls of this office. The planning and the execution of that takes hundreds of people. So again, we want to make sure that if folks are interested in volunteering, we are going to have some type of volunteer event to drum up that excitement. But if folks are looking for that, I want to throw my hat in the ring early, I want to stay updated, folks can find out more information about that under our volunteer tab. So again, understanding that Pride isn't just the folks who are on staff here, it is our entire community. And so it lives within the community, and we need folks to step up and say that they want to help and they're willing to help. So on that note, I'm excited to bring on our guests. We'll have them introduce themselves and talk about their work. And we just wanted to provide space to have some updates about COVID. Oftentimes, there's lots of updates that are happening within individual private meetings, but we wanted to provide a little bit public space to have that. So I'm going to pop in our guests.
And I think they'll say this, but it's also important to remind our guests are not doctors or medically trained professionals, but these are people who exist in this space more directly than we do on a daily basis, who work with organizations who are social service organizations, uplifting and ensuring that our community members are receiving the appropriate service and support they need during this pandemic. So I think that's really why we're excited, right? These are not doctors giving you doctor speech. These are informed practitioners in the community who are doing the work of ensuring that our community is informed and healthy.
So let's start with introductions. I'm going to start with who is closest on my screen. Go ahead, Brandon.
Zach, I feel like this is payback.
A little bit.
My name is Brandon Chapman. I am the LGBTQ Health Program Manager at Columbus Public Health. And so a lot of my work is in LGBTQ health and initiatives, but also with educating the community on the COVID-19, how we can stay safe, and any questions that you may have.
Awesome. Thank you, Brandon. Go ahead, Michael.
And my name is Michael Corey. It's really nice to be here. I serve as executive director of an organization called the Human Service Chamber of Franklin County, which is a member services organization for about 135 health and human services nonprofits in Columbus, including Stonewall Columbus. It has become 95% of my job, excuse me, to educate our agency CEOs as much as I possibly can about what's happening with COVID and how they can protect their employees and protect their community from COVID. So even though I'm a recovering lawyer by training, it's become my job to read and listen to all the people smarter than me, and then try and translate that to a wide, diverse range of nonprofit leaders. So I'm delighted to be of assistance today, however I can be.
That's fantastic. And I think that's exactly what we wanted with bringing both of our guests on, is just breaking it down in a easily digestible way for folks that maybe don't have that medical training that helps us understand things. So if we don't have anything else, I have a few questions that I would love to ask. Denzel, do you have anything before I launch into questions? Perfect.
We're good. Let's go.
Awesome. So I think just if we can have it in a succinct format, and perhaps it's not a succinct, but what are the differences between the Omicron variant and previous COVID cases that we've interacted with, such as the Delta variant?
So the Omicron variant versus the Delta variant, and Omicron is the dominant Delta variant that we are seeing here in the state of Ohio. Our first case was here in December 7th of 2021. And so what we have learned that is more easily transmissible. And so that it spread to individuals easier. And what we are learning is that the symptoms for this, which it may present itself as symptoms that in the form of a cold, stuffiness, congestion, maybe flu-like symptoms, are more readily to appear at least 1 to 2 days after exposure, and saying that is when the most time that you are contagious. What we have seen is that for people who are vaccinated, and even those who are boosted that contracts this variant, that they have more milder disease, which really helps them to keep them out of the hospital. But however, we're also seeing that in the unvaccinated persons, that this is becoming more diseases that are affecting their bodies. And so when you see the increase in our hospitalizations and our increase in testing, it's easier spread. And so at this point, we're telling everybody to mask up, double mask up, and we'll talk about what type of mask that you should be wearing now in this Omicron world. So hopefully that we are thinking that we will reach a peak of this in the upcoming weeks, and then that we'll be going down this peak. So hopefully with our fingers crossed.
That was terrific. The only additional nuances that I might respectfully add, the disease is still airborne. We haven't seen anything that would suggest, though, that gathering outside is any less safe than it was with previous variants. We've also learned that it's still not being transmitted through surfaces. If you remember, that was one of the initial concerns that we all had, and we were all scrubbing down our groceries and microwaving our mail and things like that, or at least we were. And that hasn't changed, fortunately. It's just that astonishing transmissibility that is the hallmark of this particular variant. I mean, this thing was discovered and named the day after Thanksgiving, and it has already outcompeted Delta and is the dominant strain across the country and moving into different parts of the world at just an incredible clip. It's taking off in India now, and India was the first country that really got slammed with the Delta variant. Just to give you a sense of that transmissibility. In terms of what we've learned about the severity being lesser, the reason they think that's the case is that the disease isn't able to embed in the lungs as much. It's instead of embedding higher in the bronchial tubes in that area. For whatever reason, that is the case. And the belief is that that's just one of the elements of this thing. The other piece that I'll add is symptoms are showing up faster than with the Delta variant based upon someone's exposure to it. So someone that was exposed to Delta might start seeing symptoms in 3 to 5 days or even up to 7 days. With this variant, symptoms seem to be showing up within 24 to 36 hours for a lot of folks. There's lots of other potential consequences of that, but that's one of the pieces that it can be good in the sense of we don't have this prolonged period between exposure and symptoms where someone might be contagious and not know it. We're finding out a lot quicker when that is the case. So lots of unique elements to this disease, even though fundamentally it's the same base disease.
I think both of you touched a little bit on this, but I would like to just dig a little bit deeper. I think that we've all learned a little bit more about PPE over the past 2 years. And what are some of the differences that folks need to adjust in what now feels like a routine of masking in indoor spaces with the Omicron variant versus previous editions of COVID?
So with PPE, we are now asking that cloth masks are not as effective against this, and cloth and surgical masks. And so the equity portion of that is that everyone cannot afford a KN95 mask or N95 mask. So we are asking individuals to please mask up and double mask up when they are around individuals and with masked individuals. Of course, we did a big test before you go during Christmas, but we do understand that the tests now are just now ramping back up for individuals to have access to that. And then there will be some guidelines that the federal government and the states will put around with getting tests so that we are not just giving out that in quantities and then we're at a shortage again. This is what we call a N95 mask here. And as you see that you will place it over your head, and there is a strap that maps around this. This is one of the masks. And then if you see that there is a number here that says 3M, and that means that this is certified by the government. This again is another N95 mask here. Again, same flavor here, 3M. You have a number here that lets you know that the government approves it. It sits over the head. around and should be at the top of the head with the nose like this.
Fantastic. Because that was one of the clarifying questions I wanted to ask. Prior to my role here, I worked in healthcare, and oftentimes healthcare workers went through what is called a fit test for their PPE. So for folks who are not working in healthcare, who are not going through any type of training like that, what is the fit that we're looking for?
So we're looking for anything that has the respirator side of it, the inside of it. It has this nose fix. We're right here. It has a double layer. Looking at the brand of 3M. Again, if it has the model number there, that's how we know that the government has approved the mask. Really looking at mask that does not just go around the ears, but as you saw, that it went around the bottom of my chin and then on the crown of there. And so you can look at those individuals and study those masks, really like in an Amazon setting. I don't think that we're at a part of it at the beginning of the pandemic where we're at a mask shortage, but we're asking that if you cannot get those, that you do double mask. And so I know, Zach, that you said that the center has a ton of masks that they're giving out, the surgical masks. And yes, with that, we would just ask individuals just to use 2 masks on a daily basis to provide that extra layer of it. But the single cloth mask that individuals may use, I'm going to just use this one because of my university. This one is not really usually acceptable for it anymore, but we will ask that you would put another layer of mask under that as well. Even if you want to be a little bit fashionable and represent something that we ask for you, still the double mask and put that under there as well. Especially when you're in large group settings, where you're going to the grocery store, to the mall, if you're going to restaurants, and some of those places are really heavy areas that we want to look at for making sure that you kind of shy away from. Movie theaters, large concerts. We all have to go to the grocery store, and so getting there in and out, still washing our hands as much as possible, hand sanitizing when you're there. Even with things that people don't realize, with even sanitizing if you're on having a car, sanitizing that wheel, and then if your gear shifts as well. So making sure that we're taking all those precautions that we were taking at the beginning of the pandemic, because I know that everyone got lax once vaccinations came out, and we said we didn't have to do the same thing, but we're asking everybody to be vigilant in this whole matter. But again, KN95 mask, N95 masks are really the gold standard. Looking to see if there's the numbers is there that knows that the government has registered the mask and they have looked at it and then they have approved it as well.
So, so thank you. And before I'm going to invite Michael to say something because I know he has something to say as well. But I think what I want to appreciate and take a moment to acknowledge is that you said 2 things that are really important. Right? I think while we understand that the cloth masks that we were sort of initially proposing are not as strong as the current mask, we still want to encourage people to wear masks, period. Right? So if you have a single cloth mask, doubling up, as Brandon has suggested, is appropriate. Or if you have one of the 95 masks and you want to put another cloth mask over that, that is fully up to you. But I think it's important to say that, again, in an equity space, if you don't have access to these other ones, there are a lot of community spaces that will be able to give you other types of masks. At Stonewall, as you've acknowledged, we do have a daily mask giveaway that we are now just saying if people need, they can come on in and pick some up. It's 5 to, I forget how many we give at a time, but either way, we do have a supply here that people can pick up. And I think Michael can also mention, I think in terms of the organizations you work with, you all have done a phenomenal job of bringing attention to us, places and spaces where we can get masks that we can make affordable, or offered to the community at no cost. So again, just remember to put one on if you can, and it's better than nothing. But if you don't have the access to something like a 95 and one of the 95 masks, definitely use that as well. But Michael, I see you came unmuted.
That was a tremendous answer from Brandon, and that demonstration of how to put them on properly was fantastic too. That often gets left out. So thank you, Brandon, for that service. I wanted to emphasize a couple of points there. The fit of the mask is so darn important. You don't have to have it professionally fitted per se, but whatever mask you're wearing, you don't want to be able to feel air coming in or out around the parts where it should otherwise be touching your face. You could have gotten away with that with less transmissible variants to a certain extent. It's going to be really hard to get away with that with this transmissible variant. In terms of the double masking, and Brandon, please weigh in here. One of the things that I've seen the CDC pushing has been that if you only have access to a surgical mask and a cloth mask, wear the surgical mask first and then put the cloth mask on top of it. And with either, there's a way to tighten the mask on your face if you don't have a second mask to improve the fit. It's called the hook and loop. And if you Google that real quickly, and I'm sure I can share the link and the Stonewall team can distribute it, there's a video of how to achieve that by hooking it around your ear once and then making it a little bit tighter. The other thing I wanted to add was that a lot of folks ask about kids and which masks they might wear that are a higher quality than cloth mask. There actually are not N95 masks for children because the approval process for a mask to be designated an N95 is through an entity called NIOSH, and that O stands for occupational. Kids aren't working, therefore there is no N95 mask for kids. But there are something called KF94 masks. That's a South Korean designation and body. Those are outstanding. The KN95 is out of China. Those are also good. And then there are certainly various kinds of other masks, including surgical masks that are sized for smaller faces. The other thing I would add there is the Biden administration is teasing as we speak that they're going to announce a way to access higher quality masks very soon. It's a question as to when and how many and what kind of mask that will be, but that is coming. And then lastly, we get a lot of questions at our agency about, okay, I was able to secure an N95 mask. I know it's a disposable N95. How long can I actually wear it before I have to discard it and get another one? There are lots of schools of thought on this, and I will always defer to Columbus Public Health, but we might be able to say some things that they can't because we're not an official health organization. Unofficially, I've seen a lot of epidemiologists, and mask experts talk about their strategies individually with the masks that they have, because they are expensive and you can't realistically use one N95 mask a day. That's not the way that this should be approached. What a lot of folks are doing is, for example, they're getting 3 to 5 N95 masks, and one is designated for Monday and one is designated for Tuesday, and so on and so forth. And when they're not using them, they're placing them in a box and setting it aside, or they're hanging it up and letting it set aside and then reusing them that way. That was one of the strategies that hospitals were using when there was an N95 shortage, even for them back in March, April, and May of 2020. You should not wash them. You should not bake them in the microwave. And if they do get wet or soiled, then their efficacy can be affected negatively. But hopefully that's an additional complement, or I should say helpful complement to all of the expertise that Brandon just shared.
I think that was going to address one of my questions. I think that I appreciate the school of thought that maybe our friends at Columbus Public Health or epidemiologists might not be able to say, but I think that's a good strategy, because I think that the cost is going to be the bottom line for so many folks when it comes to this. So thank you for clarifying that. Does anyone have anything to add before we move on to another question? Great. So when we're talking about testing, when is it appropriate for someone to rely on an at-home rapid test versus seeking a test from a medical professional?
So at-home rapid tests are used when we're thinking that we have the first early on symptom. And so the rapid tests are what they call anti-agent tests. And so those are rapid tests that may or may not be able to detect disease. And so if someone is experiencing symptoms at home and they think that it is COVID-19, and then they rapid test themselves and the test comes back negative, and they're still having symptoms, then you probably would need to schedule a PCR test. And so the equity portion of that is that PCR tests are very hard to come by now because with the increases of cases, everyone is getting that PCR test. So while you're waiting for that PCR test or you're scheduling that PCR test, we are asking people to still isolate during that time so that you can get a lab result test. And so that lab result test is the PCR test where it's being off, sent to a lab. It takes anywhere to 24 to 78 hours for you to get it back. And then they will give you that result. That result usually are from any of the federally qualified health centers, any of our local pharmacies, your doctors, but know that it is a task to get into that. And so that means that if you have a negative test and you rapid test yourself and you're still having those symptoms, please continue to isolate yourself and act as if that was a positive test so that you do not infect anyone else into the house. And so when we talk about isolation, that is meaning that you're away from people, you're with the door shut, that if you're using the same bathroom, that you're sanitizing after the use of the same bathroom. The biggest portion that I'm hearing now from the community is how do we isolate when we have children? And that is very hard. And so if the children have been exposed to that, they say, maybe they can stay with family. Well, we were finding out that if the children have been around you and they have had exposure, so we need to treat the children, even if they're testing negative, as if they were positive as well. And so knowing that, checking with your school system and seeing what their guidelines is for the children returning back. As it stands right now, the CDC has guidelines for isolation and quarantining once you have exposure. And so that may look different for kids. And so they're saying adult, that is 5 days. But sometimes now schools are saying that if you're not able to isolate from your children, the children have to have an additional 5 days that they have to stay out. So that's a total of 10 days that the children may have to be out of school for that. So making sure that you really look and have that, that conversation with your school nurse and that you're knowledgeable of that. But if you're not able to get a PCR test, you're still experiencing those symptoms, continue to isolate and quarantine as if that was a positive test. Because again, the rapid test may not be able to pick up, especially early disease into the body. And so it's just not for that. It's more of a micro level that a PCR test can have. Now, there are rapid tests that you can get at an urgent care or at a federally qualified health center where it's a little bit more effective, but they will usually ask if you wanted to do a rapid test and a PCR test as well. The other thing to ask for when you're now asking for with your provider is to ask for a flu test as well too. Flu-rona is now a real thing. So you want to be able to do that flu test and that PCR test all in one to make sure that we're ruling out the other one, or you may have a combination of two co-infections at this point.
Thank you, Brandon.
Again, spectacular answer. A couple other things. One, the Biden administration is going to launch its mail to resident rapid test kit program as early as next week. The website will launch, I think, in the next 7 days. And they actually just announced they're going to purchase an additional 500 million of those rapid tests on top of the 500 million they're already buying. So that will be coming. Unfortunately, the supply of rapid test kits continues to be low at the moment because the demand surged so spectacularly over the last 6 weeks. There are various places where you can buy them online in addition to in person in Columbus. And actually, we compiled a list of places where you can try to purchase them online. And as of Saturday, if you are insured, your insurance company is required to reimburse you, I think, for up to 8 rapid tests. So I can distribute that link for folks to utilize as well. The other thing I wanted to share, we get a lot of questions about how long you could test positive with a rapid test versus with the PCR test. By the time you stop testing positive with a rapid test, and that's happening anywhere between 5 and 10 days, that means you're, practically speaking, no longer infectious to those around you. But you could test positive with the PCR test for weeks after you've had your infection. That does not mean you are still infectious. That's just one of the elements of what the PCR test is capturing that's in your body still. So hopefully that's helpful for folks to know as well.
Thank you both for that. I really appreciate it.
And to add to Michael's saying, when you are testing and you're doing a PCR testing for that, it just means that the body is shedding off that disease and that virus, but it's not there. And so we know that people are the most contagious at least 1 to 2, 3 days prior to them actually showing that they are symptomatic. And so that's the very scary part. You can be around someone and they're not showing symptoms yet, and they're shedding this disease. So it's very important that if you're going to do anything, hopefully with the holidays being going, now that, that we have been really testing, test before you go. Abbott Vendex is the one that we utilize at the health department, which is the most effective. I will be sending out information today that the FDA just extended the expiration guidelines for that. And so I think that this one it may say November, so it's 3 months from now. So I think that it is more, now you can use into March. So a lot of people look at this and they say, oh, it's expired, but they just now have extended it yesterday. So I'll be sending out information regarding that today.
Fantastic. And I think that you've definitely hit on some of the other questions I have. I think we've clarified about the buzzword of 5 days. When does the 5 days come into effect? I think you've both done a really great job of answering that. Denzel, do you have any additional questions for our guests?
I don't. I mean, I think you all, and I don't know if you sort of answered this question, but I want to make sure that we really uplift it in relation to the resources and spaces where people can find rapid tests and masks. If we want to reaffirm those locations, I don't know if Brandon has anything to say about that. And Michael, we can drop that link that you shared here in our Facebook chat box so we can make sure people get it. But I just want to make sure that if there are more comments or commentary about how people can access PPE, that we make that moment available now for you all to share.
Go ahead, Brandon.
Yeah, I think that still being able to access those PPE items, whether they're surgical masks, cloth masks, that if that is all that you can afford and you're accessible to right now, that you get that and you double that at this point. Rapid tests there are still scarce. So we had a date of today, take that back, that the state was going to roll out their plan and tell us what that would be. Hopefully that may go back into our old plan where they're at recreation centers and libraries. But I do have some inkling that the state is going to put some type of ramification around that so that we don't run out of tests again. And so just be mindful of that. One of the things that I've told everyone to have, and especially if you have any chronic health conditions, is to have a COVID-19 plan in place. Have a plan in place for who you're going to talk to. Have a plan in place to your doctor, so you have medicines in place. Have a plan in place so that you have a thermometer. You have everything that you need in your house, just in the stockpiles to have that, just in case that you cannot leave the house. If you have children in your house, have that discussion of how we're going to isolate into the house, who's going to take care of what, having these real conversations with your children about COVID-19, because anyone in the house can contract that, and then what that looks like, who has to be in the room? What does that look like? We're going to be in the room. What we're going to look like for what we're going to do with meals. Having conversations with pediatricians. What does that look like? Learning about all of the medicines or everything that we have in our toolbox now. So we do have some two medicines that we have that will help people with chronic disease to prevent them from being in the hospital, in an ICUs that may be available to you. They're not widely yet available as we're ramping those up. but having all of those conversations with your doctor and to having really a COVID plan so that if this does happen, if you contract it in your family, you're not having the anxiety of having COVID and wondering about who's going to do this and who's going to do that. So having that in plan and having those real conversations, even if you're single, having someone who is going to check on you, who's going to drop things off at the door, who has an extra key to your house, if you're not, if they're not able to get a hold of you. So all of those things, I'm telling people now, have a plan in place, making sure that you have everything in your closet, everything in place for that if it doesn't happen. I oftentimes hated to say this is not at this point with the rapid spread of this, it's not really, if you get it, is almost to the point of when you will get it. And so that's the sad reality of it, because it's just really transmissible to individuals. So having that plan in place so that if you know that this may just affect you in mildly disease, that you have a plan in place that someone is going to be able to take care of it. We have a grocery store, Myers, Ship, Instacart, even if you can leave in your house or go in your own car, everybody has curbside pickup where they're just putting food into your their often sites are still utilizing EBT as well. And so that's Amazon sites for that. So there are now resources available to you to be able to access food and have medicines delivered to you as well.
Thank you, Brandon. So Michael, do you have anything to add in terms of how folks can access resources with your organization? I think you talked a little bit about the mission and vision of that. So if you could just share before we wrap up.
Sure. So one of the things that we've been trying to do to support our agencies and then the people they serve is to help route donations of PPE that come to us and then go to our members. And we're actually in the middle of distributing close to 200,000 masks in the past couple of weeks to our members. We just got another donation from the county, 50,000. That will be going out the door next week. Here's the thing. Not every agency is in a position to distribute to the public. So what I would recommend is if you have a relationship with a nonprofit, give them a call and say, do you have masks or other kinds of PPE available? And really the key one that everyone can utilize is a mask. Everything else can be specific to someone's job or other circumstances, but the masks are the key. So my recommendation would be to reach out to a nonprofit and see what they can do, see if they're in a position to help you right now. The community's been very, very generous through the nonprofits of distributing a wide range of masks. And that continues to be the case. And the masks are available. That's one part of the supply chain that has been able to stand up and stay there over the last few months. The only other thing I would add is if you find yourselves in situations where you are with people outside of your home, no matter the setting, one little thing that everybody can do, weather permitting, is crack some windows, get as much natural air flowing in and out as you possibly can. That alone makes a big difference in preventing the aerosols that might be containing COVID or quite frankly, any other respiratory disease from accumulating. When you think about how this works, think of how smoke moves in a room. It gathers and builds and it sticks around for a while. We don't know how long COVID remains in aerosols in the air, so we have to err on the side of caution. It's one of the really diabolical elements of this disease where you assume if you walk into an empty room and nobody else is there, you can take off your mask and you're comfortable. But if someone was in there an hour ago, had COVID and was breathing and coughing and laughing and sneezing, whatever, that disease might still be in the air if that room isn't well ventilated. So thinking about how you can refresh the air is a really valuable thing. At your homes, see if you have what's called a MERV HEPA filter in your HVAC unit or your unit that would usually be in the basement. If you at your workplace, ask about how often the HVAC unit is turning the air over. And what kind of filters are in place there. And there are so many federal dollars there for employers, at least, help on fronts like that. So those are some additional little pieces on top of, again, Brandon's brilliant advice on how to navigate so much of this. It's all very hard, and it's frustrating because this virus is evolving so fast that our response to it is evolving with it too. And we're not quite in front of this disease. It's evolving faster than we can learn about it, but we're learning so much every day all over the world about this new variant. And I hate to break it to all of us, we all know this, there will be other variants. But hopefully we're going to get a nice reprieve here in February, March, April. And by the time another variant emerges, we'll have more of what we need to combat this and prevent more significant disruptions like the one we've been experiencing for the last 2 years.
Fantastic. Again, huge thank you to our guests, Brandon and Michael. Thank you for sharing this really vital information. It looks like Brandon might have a last minute thing to add. Go ahead.
I could not be remiss in being a public health administrator and not saying this. Get vaccinated.
Oh, yes.
Get boosted. Vaccinated and boosted. And so what I want to say is that vaccinated and boosted will help to prevent of you getting out of the hospital and ventilators. And so many people that you may have known that has COVID, they've had mild disease. And so they may have not felt good for 1 or 2 days or 3 days. It really is because they have been vaccinated and or boosted. And so we have a wide variety. We have the widespread of the Pfizer and the Moderna vaccination, boosted as well. Have that conversation with your primary care physician. There's enough for everyone. Please, please, please get vaccinated and get boosted, please.
Fantastic. Great way to end our program. Thank you both for your time and your expertise. And thank you everyone who's tuned in. I hope that we had some new information, if not just reaffirming some information. So from all of us at Stonewall, thank you everyone. And get vaccinated, get boosted, and mask up. All right.
Thanks everyone. Happy New Year. We'll see you the next
Happy New
episode.
Year. Bye-bye.
Happy New Year.